Tēnā koutou katoa, ko Natalia taku ingoa. So I'm Natalia. I'm going to be talking about my experiences with community engagement as an early career researcher. So this research relates to complex chronic illnesses. So I'll just briefly describe what those are. So this is a general term for a set of often very debilitating illnesses with wide-ranging symptoms. These illnesses disproportionately affect women, and related to this, they tend to be very underfunded. And there's a lack of treatment options, or treatments are difficult to access. And there's typically poor awareness of these diseases, despite being quite common. But today I'm talking about a feasibility study, which aimed to classify people with multiple sclerosis in the IDI based on their service use, and to see whether the people that we identified with IDI had characteristics that were broadly consistent with what we know about people in MS, people with MS in New Zealand, based on previously published research and clinical experience and community experience. And the second aim was to test for treatment inequities by ethnic group and socioeconomic position. So multiple sclerosis doesn't actually traditionally fall within that complex chronic illness umbrella, but it's got characteristics that are quite similar to some of the other disorders, but also some characteristics which make it likely to be more easy to identify in the IDI than more traditional complex chronic illnesses like myalgic encephalomyelitis, chronic fatigue syndrome. So people with MS are commonly hospitalized. There's also specific treatments that can be identified in the IDI. So there's 8 funded disease-modifying treatments in New Zealand. There's also existing prevalence data to benchmark against. And disease-modifying treatments can have really substantial impacts on disease progression and quality of life for people with MS. So it's really important that they're being prescribed equitably. And this was also just an opportunity to see whether they are being prescribed equitably. So very briefly, some of the findings from the study was that it was possible to identify a cohort that did seem to be generally representative of what we would expect for people diagnosed with MS in the IDI. And then we did also find modest but significant treatment inequities across both ethnic groups and across socioeconomic position. But that's not really what I'm here to talk to you about today. I'm here to talk to you about my experiences. So for this project, we worked with Multiple Sclerosis New Zealand, both the national and the MS Auckland branch, Rare Disorders in New Zealand, and the New Zealand Multiple Sclerosis Research Trust. And there's some people here from those organizations today, so thank you very much for coming. So I didn't have any previous relationships as an early career researcher. So I cold contacted people off generic emails and web forms, and I was very happy when some people responded. Others I got in contact with through the community organizations and through Lisa. And I found that the community groups were really supportive, and they provided really, really useful insights into what was going on in the ground, and also had a much better understanding of the policy framework than I did. I also found that community groups were really interested in the data and really knowledgeable, and really wanted to know about the strengths and the limitations of the data sources. However, I also found that I'm not very good at community engagement. I'm quite introverted. I also find I'm very awkward introducing myself, which is kind of an important skill. I also feel really weird about contacting people out of the blue and asking for their input and expertise, particularly but this project had a really small budget because it was just a pilot study. So these organizations were providing the time and the expertise for free, which I really, really appreciate, but also feel weird about. I also, coming from the complex chronic illness community, where there is a subset of researchers that have historically and continue to cause our community quite a lot of harm, I don't feel like researchers should just be blindly trusted. So I feel like I should have to earn trust, and that I haven't done that yet. I also feel like there's a balance of engaging early enough to make sure that research is responsive to communities' needs, but also making sure that we don't waste people's time and energy when research is unlikely to be funded, which is often the case. So a lot of this comes down to that I don't really know how community groups would prefer for researchers to engage with them. Which brings me to my main point, that any guidance, feedback, thoughts, or comments on how best to engage are really appreciated, would really be very welcome and appreciated. As you'll see from the schedule, we have time for a discussion at the end. So please share any thoughts you have at the end. So I've got some further research aspirations that I'll quickly go through. So I'd like to conduct some further IDI research using the MS cohort identified. I'll also be sharing the code to construct the cohort in ID Commons so other researchers can use it. And then I want to apply for funding to classify other complex illnesses in the IDI, and examine access to health and disability services and missed opportunities for diagnosis for those conditions. And I would include MS in that grant application that I'm currently putting together. So I'd like to acknowledge the wonderful community organisations and the people at those organisations, including those here today, for all of your time and input on this project. I really, really appreciate it. Also my wonderful advisors, Stats and Zed for providing access to the IDI and for their support, and the Health Research Council for funding this research. Thank you all for listening.